I'm Jason Newsma. In these videos, we'll be providing 3 different scenarios to model ways that chaplains might use principles from acceptance and commitment training, or acceptance and commitment therapy, or ACT. ACT is rooted in behavioral approaches to therapy and seeks to, as the name implies, foster processes of acceptance and commitment. A primary goal in ACT is to foster psychological flexibility, which can be understood as the ability to experience thoughts, feelings, sensations, and memories without needless defense, as they are, not as what they say they are, and to persist or change behavior in the service of chosen values. ACT engages 6 major processes, which are acceptance, which can be contrasted with avoidance; cognitive diffusion, which can be contrasted with fusing to one's thoughts; flexible attention to the present moment, which can be contrasted with inflexible attention; experiencing self as context, which can be contrasted with being attached to a conceptualized sense of self; values, which can be contrasted with lacking chosen values; and committed action, which can be contrasted with inaction, impulsivity, or avoidance. These 6 processes are all related to one another and are often displayed in what has been described as the ACT hexaflex model. Therapy, or counseling, involves a dynamic flow between different parts of this model, moving back and forth between engaging elements of the 6 different processes. Over the course of these modeling videos, we will seek to illustrate different elements from the ACT model. This video has 3 different scenarios. Chaplain Bill Cantrell will serve as the counselor or chaplain for all 3 scenarios, each of which focuses on a different patient. All patients in these videos are actors. While the scenarios are fabricated, a number of elements from actual clinical experiences have been incorporated throughout. As you will see, the scenes have not been scripted out word for word. Our hope is that this fosters a genuine feel to the videos and also illustrates how principles from ACT might be fluidly applied in real-world contexts. At the same time, and by the same token, other counselors, therapists, and chaplains could certainly choose to legitimately employ ACT principles in different ways than demonstrated in these videos. These videos seek to illustrate principles from ACT and potential ways to do ACT. As you watch the videos, we invite you to look for things that are consistent with an ACT approach, things that might not be consistent with an ACT approach, and finally, ways that you might differently apply principles from ACT, both in the scenarios as well as in the work that you do. Now let's turn to our first scenario. In our first scenario, we meet Lisa. Lisa has come in to see the chaplain around the 1-year anniversary of her mother's death. Early in the scenario, Lisa describes many of the things she misses about her mother. She also describes ways that she's feeling stuck in her life and stuck in her grief, avoiding things like getting together with her friends. The chaplain works with Lisa to identify how some of the things that she admired about her mother might point to values in her own life. Let's watch.
Lisa, I know it's probably hard for you to come in today. I understand that your mother died about a year ago or so, and we're close to the anniversary of her death.
A year and a week.
A year and a week. I know it's a tough time. Can you tell me a little bit about her? And
She was a strong woman, very involved in the church, and she was convinced beyond anything anyone would tell her that God was going to heal her. And that didn't happen. She was a nurse, so she did a lot of overseas missions trips with the church in Africa. She also did some community service with helping with a children's group for foster children during the summer. But she was just very caring, very loving, very supportive. My dad never went to church, so she would always lovingly try to encourage him to go.
What were the things that you feel that were maybe drew you so close and made that relationship so strong between you and your mom?
You know, I was always a daddy's girl until I moved out.
Yeah.
Once I got older, I would start calling her up for a lot of advice, and we just grew to be really close in her latter years that she was alive, and she was just always there for me. She was always, if I called and she missed it, she'd call me 5 seconds later apologizing. She was always supportive of any venture that I went on. She was always supportive of my work, pushing me to do more, to get out there. She was also the reason that I went to church at the time. She kind of raised me on religion, whereas my dad would stay home. She would take me to church on Sundays and, you know, teach me how to be a good Christian, how to be a good person, how to, you know, if someone's picking on you, how to bite it up and just be a better person than they could ever be, just to be strong, to be self-reliant. She was a large part of my life back then when I think about it, but as I got older, she was a friend.
Yeah. Sounds like she was a very encouraging and a healer. She was part of the healing profession as a nurse. And sound like she encouraged you a lot.
Yeah.
And it's hard to be without all of a sudden after so long.
I've noticed a big difference, and I don't know why it's taking me so long to push out of it, but I don't feel the same as I used to feel. My friends have complained that I don't call them back, or I don't put myself out to hang out. And I mean, I know that's what I do, but I just don't want to for some reason. And
When you kind of withdraw or avoid getting together with your friends, and you're thinking about and anticipating getting together with them because they call you and want you to be with them, what kind of thoughts do you have? What kind of feelings does that drum up? What shows up for you?
I don't know. It's almost like a lack of feelings. It almost feels like there's no need to go out. Maybe it's part of it is I just feel like I don't deserve to be enjoying life when my mom's got cut short. And
Well, you named some things that it sounded really important. It sounded like they may be connected a little bit more than just in your relationship with your mother, but maybe with you as well. You mentioned she was kind of a source of strength. She was a very strong person and very encouraging, strong but gentle. You said she kind of nudged and encouraged your father to live out his faith, but she didn't push him.
no.
And that she was a very giving person. She seemed very generous in her love for children and for people maybe in great need. I'm wondering, do any of those things kind of resonate with you, that they might be tied to things that you find are very valuable or important or meaningful to you in your life?
Yeah, I think she definitely rubbed off a lot on me, especially with those types of things. Even my career field, I think a lot of that reflects how she was. And I think I took a lot of those qualities from her.
I mean, she sounds like a very dedicated and been very giving all of her life, and you gave some great examples. I'm wondering if you can kind of reach behind in other words, let's look at the motivation behind the kind of values that or things that she saw maybe in her life and that maybe you see now that were motivating her to do these kinds of things. Because I want to make sure that when we're talking about the things that I think will be helpful to you, which I would refer to them as committed actions, things that you can do to kind of move on in your life, even in the midst of the struggle that you're in right now. You know, sometimes people will think of goals, things that we do. For example, that one thing might be, I'll do a mission trip to Africa like my mother, which would be great. But there's a drive behind that that says, I want to do it because maybe that's a way of expressing love. Maybe the value is being a loving person. Does that make sense?
Yeah.
And so one of the things we should do, I think, at this point, is really look at, are the values that drove your mother to make those decisions and take those actions in her life, are they similar? Would you identify with those in a way? Are they similar to yours and the values that you have and would like to live out? You talked about her strengths and her love and compassion for children, her healing profession, all those things. Are there any like top 2 or 3 of those characteristics that she had that you would identify as maybe connected to some of the most important values and priorities that you have for your life?
Willingness to give, whether it be some fund that she can contribute to, or her time, or even just give in prayer. She was always giving selflessly. And just her willingness to love. Even if it was someone she didn't know that she knew was going through a hard time, she was all about helping and just loving on that person, and her compassion.
What comes up for you when you're thinking about your where you are right now in your life and your ability to love others and to show that same kind of love? What does that look like for you? What comes up for you when you think about doing that?
Nothing. I don't think I'm anywhere near that. I'm not me. I'm not anywhere close to where I think that she would be proud of who I am. I think if she could see me now, she would just be kicking me in the butt, because I feel like I'm a disappointment. I feel not the woe is me, but I just almost inhuman, almost like I'm just going on day by day for the purpose of living, but not living whatsoever.
Okay.
I've stopped going to church after everything happened, so there's definitely some resentment there when it comes to God.
It's hard to put your trust there again. It sounds like you feel like your trust has been violated there.
I definitely
faith.
pushed the brakes on that one. Yeah, I haven't even started experimenting back in the church whatsoever.
So I wonder if you might be able to picture, the normal, when somebody goes through any kind of trauma or loss or something, it's a lot of times the pain from that, we either want to push it away, avoid it, or withdraw from it. And sometimes it just gets us stuck in a place that we don't feel like we can move. So I want to talk to you about the values, going back to those values. And so we have your faith, we have strength, love, compassion, healing, all of these pieces that you've named. Of those things, maybe pick 2 or 3 of those that we can talk about for just a minute. Is there any that occur to you to be the strongest ones, that maybe even the most difficult, but the strongest ones?
I would say strength and love.
Strength and love. Okay. And what way did your mother show strength and love that you really grew to appreciate?
Well, she loved us no matter what we did. And she loved helping others. She just gave off love all the time. But when it came to strength, I mean, there was a time in our lives where my dad was laid off, and my mom worked 3 jobs. She was a very strong woman. If there was some family issue that was going on, she was always rising above to help others out. When my grandfather died, my dad's dad, she took care of everything. Everyone was so hurt and kind of thrown off from it all, but she arranged everything to do with the funeral just so that we could be grieving in that time.
Okay. Sounds like she was very giving and generous of her own, whatever the cost might be to her, she was doing lots of things for other people.
Yeah.
Well, my reason for asking that is not because I think it's should be a goal or an ideal that you should live up to be like your mother so much, but there were certain things, certain characteristics in that relationship and the things that meant a lot to you that you just described. So can we talk a little bit about, if you could take the smallest committed action, because that's what I want to think of, is little incremental steps can I begin to take, even ever so small, to where I can start expressing the love that I want to be able to give to others, that I can start expressing the strength that I can show to others, or whichever of those things, or even incremental steps. Is there anything that, just the thought of that, what does that look like for you? How does that feel to even think about trying to do that?
For some reason, it seems exhausting, but the first thing that came to my mind with an aspect to love, if it's a small step, it could be as easy as returning a phone call or initiating a phone call. When it comes to strength, even though he probably wouldn't notice, but just to be there more for my dad. I feel like it's been the opposite this entire time. I feel like he's been trying to push me along and get me back to where I was.
Mm-hmm. It sounds like you have people reaching out to you, your father and your friends, all that, and they want to do something, and no one knows exactly what to do. They can't fix the problem. But it sounds like they want to show that they care, but it sounds like it's also hard for you to make room for that to happen, to make space for that to happen. You mentioned when your mother, you feel like she might be disappointed with you, but on the other hand, you described her as somebody very compassionate and understanding. So I kind of wonder if it might be that struggle between your thoughts saying, I'm not doing this right, I'm not good enough, I'm not loving enough, compassionate enough, strong enough to get through this. That's your thoughts. Whereas you're describing your mother as somebody that looks at it a little differently. That she wants you to not only be able to give love, but to receive it.
Yeah.
Not only to be strong, but to let the strength of others help you. Do you think that's something that you can, or you'd be willing to work on with me?
Yeah.
Okay. So maybe just for tomorrow, let's just take it one day. For tomorrow, can you think of one step that you might commit to in service of that value of love?
Call my dad and bring him dinner.
That's a great one.
In this scenario with Lisa, the chaplain uses some of the patient's comments about her mother and things she admired about her mother to help Lisa identify some of her own values. While Lisa notes something she might do to re-engage with her values, she also appears to continue displaying some ambivalence around her willingness to fully embrace moving forward in the direction of valued actions. Over the course of continuing to work with Lisa, the ACT model might be used to help Lisa be in contact with the grief that she has surrounding the loss of her mother, while seeking ways to more meaningfully and deeply connect with her values and ambitions. Now let's turn to the second scenario. In this next scenario, we meet Tim. Tim is a 28-year-old soldier who is preparing to be medically discharged from the military within the next few months. Tim is coming to the chaplain with significant anxiety about his future. He had intended on being a lifelong soldier, and this impending medical discharge is causing significant distress about what his future might hold, given that he did not envision his life unfolding in this way. Tim has already shared with the chaplain a number of these anxieties. We join the scenario with Tim and the chaplain discussing Tim's anxious thoughts about his future and what it might look like. Let's go ahead and jump in there.
Well, let me ask you first, how often do you think when you're having some of the thoughts that you are having and you're anticipating what the future is hard to envision or what it's going to look like, what percentage of those thoughts would you say are more negative or more positive kind of thoughts right now?
At this point, it's probably 70% negative and 30% positive.
That's a pretty common response by most people. And so I just ask you, did you ever stand guard on post when you were over in Iraq? Did you ever maybe work as a tower guard around the perimeter, that kind of thing? Okay.
Yes, sir.
And let me ask you a question. If while you're standing guard as a tower guard, did you ever feel anxiety about the danger?
Of course.
Okay,
There's always,
of course.
there's
Yeah,
always
sure.
the threat of danger. Yes,
All
sir.
right. So the question is it better for you to have concern about what will happen and therefore be a little anxious about what could possibly happen and the dangers out there? Or would it be better for you to not be concerned and for there to be danger out there?
It's definitely, I believe, more to be concerned because you never know what's going to happen, and you have to be
Sure.
in that mindset wherein to know if this does happen, are we prepared?
You think about that, the possibility of being anxious about the unknown versus not being concerned about it when chances are there is some work ahead for you to work this through. Okay, so let's do an exercise if you're willing. We're going to do an exercise together, and I just want to start by just breathing.
Okay.
Because what we're going to try to do is kind of be in the present moment right now, and I want you to be able to be in contact and interact with what thoughts are going on, what you're feeling, your bodily sensations, all those things. Okay.
Okay.
All right. So just in your own pace. Just relax, and I'm going to do this with you, and just take a few breaths, nice, deep, cleansing breaths, breathing in through your nose, out through your mouth, your own rhythm. Take a minute to do that. Okay, now, I want you to start imagining and to interact with the thoughts that come up when you're in this moment, in this time. We're sitting here together, discussing some of your concerns. And I want you to consider the thoughts that you're having. And I want you to notice them, as if you were looking at those thoughts and listening to those thoughts. Just observe them. And now I want you to welcome the thoughts. And keep breathing. And I want you, as you're observing them and you're welcoming them, I want you to make space for them. Create a safe place for them to be. And as you consider those thoughts and you observe them and you make space for them, kind of soften that space so they can be gently held. And as you're holding them, I want you to think about being able to take those things that you named, those values that you named when you were training and becoming the person that you wanted to be as a good soldier. Some of the things that you've thought about that you miss or that you anticipate missing. And I want you to envision taking those thoughts that you've been thinking about and holding and making space for, and taking them with you as you move forward in your life, from the place you are now to the place you desire to be. Take a few more deep breaths. Now, when you're ready, go ahead and open your eyes and enter back into the room. Okay, how was that?
It's comforting.
Okay. So can you share with me a little bit about values that you feel like you really connected with and were meaningful to you in your service as a soldier and in your family?
The value of discipline, the value of order and commitment, the value of fortitude and the sense of belonging, the values of camaraderie. I gained a sense of significance wherein I was a part of something that was almost greater than I was, and I was contributing to that.
Right.
And the value of pride in being who I am and who I thought I was born to be, and following my passion and being that.
And when you say who I am, can you fill that blank in for me? Is that I'm
a soldier.
I'm a soldier. And when you think of what in your mind is that good soldier, I am, what characteristics might you fill in that blank with as a soldier? What constitutes a good soldier, the character of a good soldier?
Power, strength, fortitude.
And do you think you ever fully attained all of those things, or as a soldier? Or?
I tried my earnestly to.
Okay, so you worked hard for that.
I did.
Okay, and those are things that you want to carry forward in your life, if you
It is.
can, if there was
Yes.
a way to do that.
Yes, sir.
So what do you think stands between you and moving in that direction?
The fear of the unknown, which is what we spoke of, going into
Okay.
a world that I'm unfamiliar with,
Okay.
a world that I don't think I quite fit into anymore. This is all I've known since I was a kid. This is the passion that I've had, and now that I'm not able to fulfill that passion, I feel like I've not only disappointed myself, but those who depended upon me.
Okay. Would you be willing to do one more exercise
Sure.
with me?
Yes.
Yeah. Okay. I've got something I want you, if you don't mind doing this. It's here. We'll do this right here. I want you to write a couple of things down for me.
Okay.
Okay. And pretty easy. But what I want you to think about we're going to write on both sides of the paper. On one side of the paper, I'd like you to write down kind of some I am statements, kind of where you feel like you are right now. We just got into the present moment exercise, and think about those thoughts maybe that you were having of kind of where you are right now, and how you're thinking about yourself right now. So go ahead and just write down maybe 2, 3, 4 of those kind of statements. Okay. And then now on the other side of the paper, think about the values that you just shared with me, the things that you've found very rewarding and meaningful, give you a sense of purpose, both not just in the military, but also in your family, but kind of maybe 3 or 4 things that really identify those values. In other words, the person that you want to be and the person that you felt that you have been until now, something that might describe that.
Okay.
Okay. All right. So now here, you go ahead and if you'll keep the piece of paper,
Okay.
and I'll hand me my pad back. There we go. All right. So what I want you to do now is I want you to think about how connected you feel right now with your unit.
Okay.
It's very important to you, and with your family. If there's a disconnect there, if there's a distance, that kind of thing. And what I want you to do is, as an example, I want you to hold the paper up and look at the critical side of your paper. Hold that up to where you can read it. And I want you to hold it up close to your face, okay? And I want to explain something about this. But first, I want to ask you, how connected do you feel to me right now as you're looking and thinking about, and those critical thoughts are right there in your face where you can't get away from them? How connected do you feel to me right now?
Not much. I can't see you at all.
Right, okay. Now, I want you to turn it around on the other side and hold it the same way. And these are things that gave you meaning and value and purpose, right?
Yes.
Okay. Now, holding that up to your face closer, put it a little bit closer to your face. Now, how connected do you feel to me right now? Is it any more connected than you were before?
Not at all.
Okay. Now go ahead and lay them in your lap, and just kind of lay it in your lap there for a second. Now, how connected do you feel to me right now?
A lot more. I
A lot
can see
more.
your face.
Okay. Okay. Our minds have all kinds of thoughts. They have thoughts that recognize and they value and that are connected to our values, meaning and purpose and so forth. They also have lots of negative thoughts. Oftentimes around 70% of our thoughts are that way, right?
Yes, sir.
So the point of the exercise is to help us realize that they're thoughts. And those thoughts evoke feelings. And all those things are things that pretty hard to push away, withdraw from, try to run away from them usually doesn't work too well.
Yes.
And so here's a what if question. What if, and it may be hard to imagine right now, what if we could come up with some actions that you can take? Because part of being a soldier is taking action, right? Even in adverse situations, right?
Yes.
And right now what you've described to me is that you're in a situation where you're living with anxiety about a future that's uncertain,
Definitely.
which is kind of like being a soldier in an adverse situation. The future's uncertain. But that fortitude is a great word. It's, you kind of push through it because there's something bigger and greater than the anxiety, right?
Yes.
So let's think about that possibility for moving forward in your life. So let's think about committed actions that you can come up with that would be in service of those values that are important to you. What can you think of that you might do in service of those values that you named?
Well, you know as well as I do that there are systematic approaches to just being a soldier. There's an approach to even getting up in the morning. So to just take a rising and being able to take on that day and saying that this is going to be a good day. I'm going to have a good day, and I'm not going to worry about what tomorrow may bring.
Sure. Okay. So one thing is like set your alarm. Make sure you get up when you know you need to get up. Okay. Do that. Is there something that you could do that would reflect a working towards the value that you've named, like that sense of pride or that sense of belonging or that sense of strength? Just something for tomorrow.
Taking pride in the fact that I'm still a soldier.
Okay.
Still taking pride in who I am and embracing that and comforting myself in that and knowing that no matter what may come soon, that at this moment, I am who I am.
Okay. So let's just stick with those two for right now.
Okay.
Those two committed actions.
Okay.
Think about those. You might even write it down for yourself, and we'll start building upon those in time. And I think just by virtue of focusing on those committed actions in service of the values that you have chosen for your life, that some of the anxiety, while we still have to take it with us and be willing to make space for it in our lives, the impact of that will begin to diminish.
In this scenario, the chaplain responds to Tim's anxious thoughts about his future by inviting him into an exercise that engages elements from the left side of the ACT model, processes of acceptance and cognitive diffusion in particular. The exercise invites Tim also to engage with the right side of the ACT model, in particular as Tim identifies values that are important to him. Hopefully, some of the values that Tim has identified can help to guide actions as he moves forward toward an uncertain future. Future work with Tim may want to focus further on distinguishing values from conceptualized sense of self, such as the idea of self as soldier, which the chaplain has begun in this scenario by elaborating on values within the sense of self as soldier that can persist after discharge from the military. Now let's take a look at our third scenario. In this next scenario, Chaplain Bill Cantrell will be working with Robert. Robert is a 30-year-old veteran who can be understood as struggling from moral injury related to an event where he killed civilians who did not slow down at a checkpoint. Robert opened fire on the vehicle only to discover soon afterwards that non-combatants were inside, a mother and a child. The mother was killed and the child was wounded. Robert has left the military and is now married with children. We join the scenario with the chaplain inviting Robert to participate in an exercise to become present to the counseling session.
Could we do just a short exercise to kind of so we can both be present with one another? I want to be fully available to you, and if that'd be okay with you? Sure. Okay. You don't have to close your eyes or anything. It's just what I want you to do, take some nice breaths and in your own rhythm, and some relaxing breaths, cleansing breaths. And I want you to think about, as you're breathing, the kind of thoughts that you've been having about coming in today, the thoughts that you're having now about talking with me about some uncomfortable things, and noticing those thoughts and kind of how they're affecting you, as if you're observing the thoughts. And as you're noticing those thoughts, think about how your body responds, what you feel in your body, if you feel any tension or anything going on, like tightness of your chest, or ways in which your body responds to the thoughts that you're having. Scan your body, starting with the top of your head and working your way down, your jaws, your neck, your shoulders, your back, working your way down to your feet. And notice how you're feeling when you have those thoughts. and notice where those thoughts and those feelings are coming from. And now I want you to use your imagination for a moment. And putting all those thoughts and those feelings and bodily sensations in a sack. And tying the sack at the top and throwing it over your shoulder and walking forward as you carry them with you. Okay. Can you share with me a little bit about what kind of thoughts came to mind, what you noticed during that?
There was anxiety. There was disgust. Some hatred. I couldn't visualize putting them in a sack and putting them on my shoulder. I couldn't take them off.
It's a pretty heavy burden. Disgust and hatred have a lot of weight to them. Have you tried anything? I mean, do they come up sometimes when in your relationships? You have a young daughter, don't you?
Yes, sir.
Yeah. How's your relationship with her? Do you have these thoughts sometimes when you're around her?
Yes, sir.
Yeah. And what do you normally do when you're having these thoughts and you're with her?
It's pretty uncomfortable, so I don't know, I can't stay long. Remove myself from that situation or go somewhere or just create some distance.
And then how do you feel when you create that distance? How do you feel with your relationship with her? Does that prompt more thoughts and more feelings, or?
Well, I mean, it's conflicting, I guess. So on one hand, I want to be there. And on the other hand, I don't want to. I don't want to contaminate her.
Yeah. And how about with your wife? Is it similar or different, or?
No, I want to be around my wife. She doesn't know everything though.
Yeah.
I don't think she can know.
Do you
can't
feel
know.
like you can be close with her right now, close to her?
No, I mean, no. I feel like I'm as close as I can be, but that's not.
Yeah. I'm going to ask you to consider something. Sometimes when we feel pain, it is a flag or a signal to us, kind of a demand signal that says there's something very wrong. And can you maybe put your finger on it or identify what do you hold so dear, just like your daughter and your wife and your duty in service for your country? Is there anything that with this event that's happened that's created seems such a burden with those memories and thoughts and everything? Is there any way that you can identify what was violated? What do you hold so dear that was violated?
innocence. I took innocence.
The burden seems too great, doesn't it? Robert, I want you to, if you're willing, to do something with me, but I want you to notice first what you're feeling right now, what your thoughts are about this the pain of feeling like you violated something, you've taken away something, someone who was innocent. If you're willing, I'd like you to try something with me, and I want you to visualize a friend of yours, somebody that you're really close to. I don't know if you've got a closest friend or somebody you've served with that you feel like you could really trust. You guys kind of got each other. You understood each other and had each other's backs. Is there somebody like that in your life? Or?
Yeah, Jonathan.
Okay. I want you to, if you would, visualize yourself sitting in a room. You have the thoughts that you've been having here just in the last few minutes. The feelings that you've expressed to me and what you've been feeling. I want you to envision yourself with that posture that reflects those feelings and those thoughts, and notice your thoughts, what you're thinking at the time, and visualize yourself in that corner of the room, and your best friend is Jonathan is across the room. He's looking at you and he's observing you, and he's seeing you in that posture and having those thoughts. And he looks across the room as someone who understands you and appreciates you. And he's watching you. Do you have any idea of what he might want to say if he was to walk over to you? What might he say to you?
I don't know. I mean, I feel like, I don't know. In my mind, it works better if I feel like I'm picturing him and I'm talking to him and what I would want him to hear.
What would you want him to hear?
He made a mistake. We still love you. I want to help him up. Give him a hug.
What would you want him to do with his life now that he's had this experience?
I want him to be able to move on.
How would you want him to be with his family?
I guess like I knew him to be with his family.
Yeah.
You know, like he was.
Do you think it would be easy for him to do that?
Probably not.
Can you envision him getting support and encouragement from others along the way?
Yeah.
Do you know him to be the kind of guy that has pushed through adversity in the past?
Yeah, I mean, he's not a pushover.
Yeah. I wonder, when we were we did that little exercise when we first started talking, and I asked you to make space for some of these thoughts and feelings and bodily sensations, to kind of hold them lightly and carry them forward with you in the sack. And it seemed like that burden was just too much. You couldn't move.
I felt like I couldn't take it off and put it in the sack.
Yeah. I'm wondering if the kind of compassion that you want to show and the love that you want to show Jonathan, who's carrying his burden, if you had people in your life that wanted to show you that kind of love and that kind of support and encouragement, if you'd be willing to make space for that, for yourself, for their compassion towards you.
There is. There's so much fear and hesitation with
Yeah.
letting it be known who I am, what I've done.
Well, you know, there's probably some of that fear and that anxiety that has not only brought you to this place and time talking to me because of this experience that you've had, but and how it's affected you, your life. But it's probably also kept you alive in many ways. I mean, we kind of use that, we learn to channel that in our military service sometimes. You know, warriors have to learn how to take that fear and anxiety and channel it into becoming a good warrior. I know some of the most famous people in the world carry tremendous anxieties. And one of them I heard one time, he said that, yes, I'm still anxious when I get up and I talk in front of people. I always feel that. But after 35 years of doing it, I've kind of learned to take all those butterflies in my stomach and make them fly in formation. I use them. And I'm sharing that with you, not because it's like your story, but because it illustrates a principle that we can take those fears and these anxieties and help them and use them to help us, one, understand this is a signal that something's wrong, and something I care about, something I value, that innocence of your child, that wholeness of relationship with my wife and my daughter after this has happened, and being able to see how that, of course, has profoundly affected your life, but it's affected your life because it's in contrast to what you hold dear.
In this scenario, the chaplain begins by inviting Robert to be mindful of the present moment. Throughout this particular video, processes of acceptance and commitment are engaged in different ways, with shifting occurring between ways that Robert might make room for a full range of emotions. For example, regret as well as love from those around him, while also finding ways to identify and re-engage with some of his values. In this scenario, the chaplain does a good amount of talking and guiding the patient through different exercises. While this video helps to illustrate how to possibly guide a patient through different elements of the ACT model, over the course of a full session, ACT will typically involve much more interactivity between the patient and the counselor. The aim within these ACT videos has been to introduce some ways in which chaplains might use principles from ACT as part of their pastoral care. Remember that there are multiple options open within ACT for how to approach any given scenario. Perhaps these videos have encouraged you to think about different ways that you might have approached the scenarios using principles from ACT. Or perhaps you've been encouraged to think of ways to use ACT within your current work. As you learn to apply ACT, we encourage you to revisit these videos as well as to rely on other instructional content, readings, and feedback from professionals who are versed in the application of ACT principles.